My name is Mary Gillen. I'm sister in the unit of Urology Daycare, which is situated in the Belfast City Hospital. And within our unit, we run a Men Against Cancer unit. This happens on a Tuesday evening where we have a clinic, and it's a self-referral clinic where men can make just an appointment, don't need to go through your GP, and just come up and chat to us in the unit here. So what I'm going to do is just briefly show you around so that if you do come visit us, you know what to expect when you get here. So this is just where you would come into the unit. This area would be the waiting area. So behind you would be where you actually check into the unit. So if you give your name and details and that, come and have a seat, and then as soon as we're ready for you, we'll just take you on through this way. So this is the first thing you actually see whenever you come into the unit, and this is we use it as a waiting area, we use it as a admission area. If you're coming up to the evening clinic, you can access, we have laptops sitting beside the chairs where you can access different sites that would help maybe with the condition that you're worried about. Now I'm just going to show you one of the areas where you would go to get one of your investigations if you were attending. So this it's just the room where we would do the testicular scanning. So if you present it with worries about any testicular problems, you can come here on a Friday morning after being seen at one of the clinics, and what we do is get a radiographer to scan the testicles for you or wherever you're worried about, and then that helps in making the diagnosis and planning any further care that you might need. We'll just move on up here. We have various rooms within the unit which do various jobs. We have the usual very basic rooms like our toilets, where are obviously part of the procedures. You may be asked to do urinalysis and things within these. Then we have areas which have a bit more of a stronger investigation. In here we would do like the prostate biopsies. In this room, as you can see at the minute, there's a bit of a teaching session going on. We do have regular students coming here to learn. Now we're just going to move on to the area which we do something that's called a LUTS clinic, which is lower urinary tract symptom clinic, and we do various assessments here throughout the week with that. But one of the main tests that you may have done is a flow rate and a bladder scan, and it's just a very simple test where you're asked to pass urine into just a machine that sits here. One of the other tests we do within the unit is a test called urodynamics, and it basically would be a test to show how your bladder's working, if it's working okay, if you're passing water fine, or if there's some sort of obstruction there and it's just not functioning to the ability that it should be. The next room we'll go into is really where we treat bladder cancers within the unit. Bladder cancer is also very prevalent within our community, and what we do is instill some either chemotherapy or immunotherapy into the bladder, and you get a course of it for 6 weeks, and after that, after the 6 weeks, you usually get a follow-up where you have a cystoscopy to have a look into your bladder again to ensure that the treatment has worked or plan any further care that you may need. And we do get some very positive outcomes from this treatment. The nurses area, and this is where we keep all our information and where we basically manage from day to day what's going on within the unit. So this is the hub. And last but not least, this is what we call our consultation room, and basically whenever you come up and have some investigations done or some tests done, the consultant will call you back up here and you'll come into this room and just have a chat with them about your results and if there's any plans of care that need to be offered, and hopefully get totally sorted out. So if you do have to come to Urology Daycare and the Men Against Cancer Clinic, we hope that this has given you a bit of an insight as to what to expect when you get here, and that you have a comfortable journey throughout.